Well, for more on this topic, we head to New York, where we're joined by Dr. Dmitri Alden, liver cancer surgeon and surgical oncologist at Lenox Hill Hospital. Thank you for joining us.
Thank you for having me.
So talk about some of the most promising developments that you're seeing in this space.
I think today cancer care is changing and changing very quickly because we see a shift, and that shift is towards individualization of care. In the past, we used to place the patient in a box provided by, for instance, in the United States National Cancer Institute, which we still do and use its information as guidelines. But what we are doing today more and more, we're finding ways to find a treatment that's hand-tailored and individual to one patient. And therefore, it's going to be much more successful, and that's the future of cancer care, in my opinion.
So in this role of trying to find more personalized care, how is artificial intelligence helping in the cancer fight and perhaps some of the outcomes?
Well, artificial intelligence it's a multi-specialty tool that is allowing a lot of advancements today. And artificial intelligence is a data bank in many instances. And that data bank can provide massive amount of experience accumulated by the humankind in medicine worldwide and analyze the data from one individual patient against the experience for millions and millions of people and physicians that put that data into that data bank. That's one way. The other systems on artificial intelligence are situations where we can use telemedicine. We can provide lower income and a little bit less developed countries where the medicine is a little more scarce, right, with direct access to our knowledge base and give it live using telemedicine and telemedical help.
Now, we did see a lot of reports recently about this small team of Israeli scientists who have claimed to have developed a cure for cancer. What are your thoughts on this?
Well, obviously, the entire cancer treating community has been informed on this discovery, so to speak. But you have to be very, very cautious, and you have to be careful when you announce things like that. In my opinion, it's somewhat unethical because the data is not available. The data hasn't been published in peer-reviewed journals, and scientific medical community hasn't had any chance to review the results of this particular treatment that has been announced. And in addition, it is very clear in the interview that you can read online that the creators of this so-called new cancer cure said that with a right budget, we can take this care to the market very quickly, which to me sounds like it's one of those announcements and call for investment.
Now you mentioned cost, something that a lot of people may not be aware just how expensive this is. So walk us through the process of trying to get a cancer drug or treatment to market and some of the common barriers to entry.
Well, the process of taking the cancer drug to the market is very streamlined, at least in this country, by the FDA. It requires a sequence of clinical trials which are predetermined and defined by the FDA panels, depending on the type of the drug and the treatment and what disease that drug is intending to cure. If we're talking about a brand new drug that has not been on the market and it's not a repurpose, it's a very elaborate, complex, and highly expensive process that costs millions and millions of dollars. In some instances, it could cost up to $1 billion to take a drug on the market.
Now, we know that there's obviously now a lot of DNA kits that are helping people try and find markers for cancer. And you also have this huge disparity in terms of outcomes between wealthier and poorer countries and the sorts of treatments that are available to them. Talk about what's being done to kind of make people more informed, but also make this more accessible for people.
Well, I think the information technology and social media has made a tremendous difference, and I can see it firsthand from my personal website that I put out and updated throughout the years, and through the help of search engines and the internet more available in worldwide, people are accessing the information that's provided by various medical sites. They're seeking treatment. Also, with the new technology that we just touched upon earlier, you can have remote consultations, you can have remote treatment, and that is advancing the situation. The population growth, the cancer cases are growing, but so is the access to healthcare, and the access is growing much faster because of all the technological advancements that we have in telemedicine and remote control, so to speak, care that we can deliver.
Right. Dr. Dmitri Alden there, liver cancer surgeon and surgical oncologist at Lenox Hill Hospital. Thank you so much.